it kind of is a balanced diet. So this diet can be healthy if there is balanced consumption of all of the various paleo food sources. There is a valuable insight in this diet's design. Greater processing of food has led to adverse effects on health. So the point is that not all of the paleo food choices are necessarily good. However, some potentially nutritious foods are off limits, particularly whole grains and legumes. We need to have this in consideration. The paleo diet is a potentially healthy diet based on a valid premise about the harms associated with modern processed foods, but overindulgence in fatty meats can immediately turn these potentially promising diets into a health disaster. So we need to have all of these factors into consideration. Let's dig into vegetarian diets. A vegetarian and plant-based diet eliminates meats and meat products. There are several variations depending on whether additional animal products are consumed, and we see this before. Many vegetarians restrict their diets beyond health rationale for ethical and environmental reasons. We all know that. But in general, most people's diets could be improved by moving in direction of less meat intake. And in this point, they are clearly a few steps ahead of us. Actually, we know that in several studies, we have shown that vegetarian dieters, they have very low levels of LDL compared to the general population. And we all know that we are giving statins to our patients so that we can have the LDL in control. And we kind of think that this premise is coming from the research found associated with this kind of diets. So numerous studies shown that vegetarian diet is one of the most effective for maintaining health. Plant-based diets are healthier than diets where meat is consumed, whether it's measuring the occurrence of diabetes, heart disease, cancer, and death. So we all know this is the way to go in diabetic and heart patients, and honestly in the overall population, because if we are trying to prevent this pandemic and we know where is this coming from, that is from our lifestyle choices, this is a way to go. And honestly, the only potential downside to this might be vitamin B2, B12, but we all know we can consume some animal sources without eating them every day and eating them enough to lead to its harm sides. And one downside that usually is indicated about not getting enough protein sources from vegetables. This is not true, and it has been extensively studied. At this point, we know that vegetarian diets does not necessarily compromise the intake of protein. So digging into Mediterranean diet, that is a very particular plant-based diet. And I was so interested in this because I come from Portugal, and I decided to do a review, and which I published in the Metabolic Diabetes and Endocrinological Portuguese Society magazine. And I will try to show you a little bit of this dietary pattern. So this is the pyramid of Mediterranean diets. As I told you, Mediterranean diet, it's not just a diet. And one of its really good benefits is that it includes the diverse forms of the lifestyle. As you can see here on the basis, we have the behavioral changes, which is something that other dietary patterns do not include. So you see that they promote the cooking at home, cooking with family, eating with family in a relaxed environment. They promote physical activity, stress-free lifestyle, eating the food that is in our yards, collecting and then going to the kitchen. It really brings a relaxed flavor, plant-based lifestyle. And then you have the water, the hydration, and then right next to it, the plant-based, the fruits, the vegetables, and the fruit, the vegetables, some fats, some vegetable fats, namely olive oil. And you can see that all of these, they promoted to be produced locally. And this will reduce the amount of pollution in the world. This will reduce the amount of chemicals you need to use on foods to conserve them. And you can see how powerful this is. Right next to it, right above, you have olive oils, nuts, seeds, and this kind of stuff. And then in the top of the pyramid, with much less representation, we have dairies, we have fish and meats, we have potatoes, like carbohydrates in a little slower, not carbohydrates, it's potatoes and processed meats in a very, very lower basis. And then sweets only in party days. And then we have wine in moderate quantity because it is linked to our culture. So you see, this has a lot of things into consideration. It has the plant-based dietary pattern, it has the lifestyle, the activity, the culture, the social support. It is a very pattern lifestyle program. So the diet emphasizes a style of eating once common along the Mediterranean Sea. So it also has into account our generation, our culture, and our natural evolution. The Mediterranean diet is the most scientifically tested eating pattern, showing substantial health benefits. A broad range of comparison with other diets indicates that the Mediterranean diet is associated with reduction in heart disease, diabetes, cancer, and total death rates. The Mediterranean diet involves more than just selecting general healthy foods. It also includes social meals with family members and plenty of physical activity as well. So it is practical, it is flexible, that allows you to have this pattern throughout your week, your daily basis, and then once in a while you can eat a cake if it's someone's birthday. You can eat red meat if you go to a restaurant, as long as it's very occasionally. And then it has a science backup. It's a well-proven diet. It has been around for several of years. It is it has a very firm scientific proof. So Mediterranean diet has similarities to several more extreme diets that can be thought as a sensible compromise in place of more radical diets. For example, the diet is basically a relaxed vegetarian diet that allows some fish and chicken, as well as infrequent intake of red meats. Okay, and likewise, a Mediterranean diet is similar to a paleo diet, but allows some older but post-Paleolithic food technology into the kitchen. Basically, it allows a more balanced and healthy choices than, and it's more flexible than the others we've seen before, but with the benefit that is plant-based related. And from someone that comes from Portugal, I can give you my personal experience. So we see the Mediterranean Sea and we see the Mediterranean diet. It's a pattern that comes from all the countries that surround this Mediterranean Sea, mostly in Europe. So, for example, if you go to Egypt, they don't follow this kind of diet as much as Italy or Spain or Greece. And we see when we watch Italian or Greek movies and they represent their culture, we see they are happy, they are singing, they have big families around the table eating eating food in the backyard. And that's kind of the culture we have in Portugal also. We have a lot of vinery culture, we have olive oil plantations. And for example, my grandparents, they have these kind of plantations in their hometown. And when I was little, I used to go there and to help them to collect olive oils and to help in the grapes collection. So it really is part of our culture. And however, we have seen a very important transformation. So you see, I met 2 generations ago, my parents and my grandparents. And we've seen a big change with industrial and our economical race. So for example, in the times of my grandparents, I remember my grandparent, he was the oldest of 9 siblings. And so his childhood would be working in a vinery, working in the lands. They had three sardines to 9 kids. So you imagine his lunch would be mostly plant-based, and then half of a sardine. And then the rest of the day he would spend in physical work in the camps. And we've seen a drastic change towards the industrial area and the American processed foods implementation over the world with economical based pattern instead of plant-based pattern. So when I grew up, my childhood was the opposite of my grandparent. I would spend the whole week sitting on a classroom. I was learning. I'm not saying it was worse at all, but in terms of physical activity, it has decreased. It has decreased significantly. And I spend my weekends watching TV, and in the breaks we see all these advertisements of cereals and nutrition for kids, which is overall processed and sugar with enormous sugar amounts. And these enormous sugar amounts, they create kind of an addiction ritual within children that they will take to the rest of their life. We know that this amount of sugar are more addictive than cocaine. Several studies have shown that. So this has leads the general population to turn from this representation on the left to this representation on the right. In my generation, we see so much overweight people. We start seeing overweight and diabetes in much early ages. We start seeing their complications with heart attacks and strokes in early ages. And this is what I wanted to bring to you. Also, just a final, I don't know if I'm overcoming the time, but just a final note on the diet vs bariatric surgery. So the thing is that surgeons have been defending that bariatric surgery, besides anatomical transformation, they can bring a metabolic change as a consequence. And because of this thesis, the Texas University Clinic has published this very interesting article where they compares people who are undergoing bariatric surgery with people who only have diets. So they picked the patients that were going to bariatric surgery, and they suggest them they would be inpatients some weeks before, and they would go through diet without going to surgery, but they would do the exact same diets they would do if they have surgery, because we know people that go under bariatric surgery, after they have to follow really strict diets. And actually what was seen is that not only they had the exact same benefits, sorry, I don't explain this. So they went to the clinic, They go through these diets and they see some very beneficial changes, but then when they regain the diet because the behavioral it's not being controlled, they would go to the clinic and go under bariatric surgery. So it is the same patients and the same diet. The only thing that changes is bariatric surgery. And what they've seen is that actually the diet was superior, because with only the diet, without the surgery, they not only they have all those benefits associated to a very restricted diet, especially compared to what they were taking, and a very controlled nutrition diet, but they also didn't increase the pro-inflammatory cytokine levels that you would see after the surgery. And this is a very powerful statement that obviously it's great that we have the bariatric surgery option for diabetic patients and for obese patients, but actually diet changes can be even more powerful if done correctly. And this is what I had for you. I really hope you enjoyed, and we could take some important notes for your clinical practice. And let me know if you have any questions I can ask for you, I can answer. Thank you.